Question number 9, name of Deputy Terence Flanagan.
Yeah. Thank you, Concor. Let's just ask the Minister in relation to providing a 24-hour service for psychiatric patients at the Aislin Centre in Beaumont Hospital, that there has been instances, unfortunately, reported in the media in recent weeks where there was clashes there and potential problems. So just if the Minister can advise the House as to when 24-hour care will be provided in the Aislin Centre.
Thank you.
It's been the experience of North Dublin Mental Health Service clinicians that most of the cases presenting to the emergency department at Beaumont during out of hours are referred to the on-call psychiatry team. That these cases are often complex and multifaceted and often require the input of other hospital services. People presenting, for example, with intoxication, overdose, confusion or self-harm require assistance with these issues. And while there may be an allied psychiatric condition, other aspects of their care will fall to the emergency department to deal with first. Mental health acute units, such as the Aislin unit, are not designed or staffed to deal with these issues. Direct admission to a psychiatric bed without a thorough medical assessment would constitute a significant risk for patients. As there are no plans to include an out-of-hours assessment centre at the unit, people presenting with complex issues are first assessed at the emergency department. North Dublin Mental Health Services work in partnership with Beaumont Hospital Liaison Psychiatry and the emergency department, so the needs of individuals requiring mental health services are coordinated to ensure optimised patient care. 2 nurses from the mental health service assigned to the self-harm programme work in the emergency department. An additional self-harm nurse, a clinical nurse specialist level, is also being recruited. It's acknowledged that North Dublin Mental Health Services have recently experienced some difficulties in terms of bed capacity. However, the HSE is working to address these issues, with the number of available acute beds being kept under review and the recent approval of funding to facilitate onward discharge to community placement. The Aislin Centre currently has 38 psychiatric adult beds, of which 37 are currently occupied. Approval is being sought for a further 10 beds for 2016 as part of the ongoing development of North Dublin Mental Health Services.
So I thank the Minister for his response. However, it's hugely terrifying, that situation at the moment up in Beaumont. I mean, it's an already overstretched ED department, as you're well aware, Minister. But when you have psychiatric patients there, I suppose, as well as ordinary patients, there can be problems, and there have been, unfortunately, some negative, instances actually happening. And then when staff are there trying to work and do their job, and unfortunately one staff member, was stabbed, which is horrific, really. So it just doesn't feel a right or a safe environment for that to happen in the first instance. So there is an absence of 24-hour 7-day-a-week assessment in relation to mental health patients. They should be getting the need, they should be getting the help and the necessary care that they need. So, can you address this, Minister?
Sure.
I think it's important to say that all major emergency departments have security and have security on site. And unfortunately, it's not just mental health patients who can attack staff or other patients. That is a very sad feature of our health service, that sometimes patients attack staff, and that can be true from the ambulance crew to even reception staff, and that's a very unfortunate reality that we have to face all the time. What happens in emergency departments, by and large, is that when psychiatric patients do present, they have other problems as well. So, say for example, they have had an overdose. That's a medical toxicological issue that has to be dealt with first. They may, for example, have injured themselves, cut themselves, slit their wrists, potentially tried to hang themselves, maybe even have shot themselves, or done some other form of harm to themselves. They can also present with very severe medical problems because of their psychiatric illness. They haven't been looking after themselves, and they may have a very bad infection. So all those things actually have to be dealt with first. It's not the case that somebody, because they have a mental illness, can be just shipped straight off to the psych ward.
Thank you.
It should never have been done that way. And it's important that where they do have medical or surgical or other problems, that they're actually dealt with first, that they're medically cleared before they go to the psych ward.
Thank you. I suppose to ask the Minister, have there any other incidents in other hospitals where these type of situations have taken place, where there has been violence directed towards HSE staff, and where that hasn't, I suppose, really been reported in the media? And to ask about, in relation to the Vision for Change, I mean, that said that there would be 24-hour assessment be provided for mental health patients. When will that actually happen, Minister? Is there commitment there? Like, when will the necessary resources be put in place to ensure that that happens, and particularly at the Aislin Centre?
Deputy Rahman, quickly.
My colleague Deputy Flanagan, Minister, we're getting incredible complaints about the situation, and people ask, well, if you look at other mental health hospital facilities, that there are A&E facilities in those hospitals, an A&E type function, and can there not be a separate function even within the existing A&E in Beaumont? Thanks again.
Thank you.
Yeah, I don't have the figures. I don't have the figures off the top of my head, but it's certainly the case that assaults on staff occur in other hospitals. It's a particular feature of psychiatric hospitals. It's a feature of care homes as well, and it can also be a feature in emergency departments. So, it's not a particular health service. It happens to the Gardaí, it happens to prisons, it happens in other places too, to teachers as well, where public servants get assaulted by their clients, which obviously is never acceptable, but is the reality of the environment in which dedicated public servants often have to work. In terms of the 24/7 service, what I'm advised is that they currently have 2 nurses working in the emergency department assigned to the self-harm programme. One is a qualified CNS, and the other is working in acting capacity. One of the nurses works a 7-day fortnight roster, that's a 12-hour shift. The other staff member works a 5/7 roster, which is 9 a.m. to 5 p.m. A further appointment of a self-harm nurse at clinical nurse specialist level is being progressed via the NRS panel, and will be filled in the near future. And it'll be general, although I don't know if it's absolutely the case for Beaumont, but it will be the norm for a large hospital like that to have a psychiatry doctor on call at all times. But like I say, that doctor may not be called until the patient's medical issues are dealt with first.
Question number 11. Question 10.